In Vermont, we like to be prepared. Whether there's a power outage or a flood, we want to be able to take action quickly and effectively. That's why communities, emergency responders, and other organizations can plan ahead using a tool called the Social Vulnerability Index. This online tool will help identify populations who may need more help in case of a threat to public health. You can find it through the Environmental Public Health Tracking Program. The Social Vulnerability Index incorporates 16 different measures that fall under 3 themes: socioeconomic, demographic, and housing transportation. Let's say you're drafting an evacuation plan and want to know where there are higher numbers of people without access to a vehicle. From the tracking page, click on Explore Vermont Data. Then scroll down to Vulnerability Indicators and click Search. Here, look for Housing Transportation theme. Then go to View Maps showing individual housing transportation measures. In your new window, click No Vehicle. The map now shows you where a larger portion of the population does not have a vehicle, and therefore may need extra assistance to evacuate. The darker the color, the higher the percentage is of people without a vehicle. You can see this census tract has a higher proportion of people without a vehicle. If you zoom in, you can see this area is the northern section of Barre. When you click on it, a box pops up giving you all the vulnerability data on that area. Scroll down to see that 15% of residents do not have a vehicle. You can now target this population in your planning and outreach. You can also use the maps to compare data across themes. Perhaps your home visiting organization wants to focus injury prevention home visits in communities with a high proportion of older adults and people living in poverty. You can compare the elderly map in the demographic theme with the poverty map in the socioeconomic theme. Using the Social Vulnerability Index can empower your organization to make decisions based on data and better serve the people who need it most.